investments. In commercial, I was there, it was still a time of Dr. Zara. No pharma company wanted to take a risk on Lagundi or Sambong. And then, of course, he failed. And then 3 companies were licensed, 2 failed, and 1 succeeded. That's Pascual Laboratories. And then it became 6, and then it became 16. So, pasensya na. Hugot, again, personal, that's not a statement of my company.
So, equity not just for the consumers, but the partners as well, investors.
In commercializing these technologies or products that are the product of R&D.
I move on to Dr. Ryan as in your organization, how do you make certain communicating those studies?
Siguro something na ginagawa namin, 3 things. 1, we usually do social action, operational researches. So people are participatory po yun. So people are already involved. So they would see already what's happening. And we saw that we're strong in research production, the program. So we move into that. And I hope
so that is the reason why this group for research. So in other words, it's not just a matter. The office is also responsible in making sure that it.
Yeah, it's a very provocative question. In billions of dollars into research that justifies the use of a product that's very harmful and that kills people. And the World Health Organization had its first research where research
that actually the trend now is responsible for conducting the research. That's a different story. So it's without the details, it's hard to make that comment. But then, if it's plagiarism, that's another discussion again. So maybe my only message to the group now is to clarify the membership of the author. Usually we do it from the very beginning. Maybe this is one of my advice to the team, especially when you're doing big collaborations and big groups. Usually we resolve authorship at the beginning, as who's really part of the project and who are just assisting and are not part of the big authorship. But the lead primary investigator usually has a big say on the sequence and the numbering and who becomes the first and the last author. That's being resolved. So if maybe privately I can take a look at the question and then maybe you can answer it in full.
Okay, we request the audience, please be ready with your questions. We're down to our last. As experts in your respective fields, how does research and innovation contribute to equity in health? Anybody can answer.
Dr. Padilla, I'll start. I'll speak for UP Manila. Well, we say equity in health for all. So we have the great majority, if not all of our proposals, all of our programs would focus on conditions that affect Filipinos regardless of social standing. So when I talk about diabetes affects actually the rich and the poor. I talk about tuberculosis, I talk about dengue, talk about cardiovascular diseases. So the choice for us, the choice of the project, will actually focus on doing that. But let me just qualify that we do have some researchers who focus on very specific areas, okay? And I will not discount the value of those projects because they're equally valuable. And I will just give one example. Dr. Eva Kionko de la Paz and myself have a project on the Negrito population of the country. So we actually looked at the 35 groups from north to south. And that is servicing with common diseases.
The settings as a social determinant of health and change that can be useful for changing the inequity gradient. So I would say that in order to have research that is effective in reducing inequity, we have to be open to other forms of measurement. And
an employee of the Cagayan Valley for about the PPAC. So, but I'm also a consultant of researchers of doctors of medicine sa Cagayan Valley Medical Center. Okay, this question is for Dr. Francis Gomez as a program manager of the digital health. I have a consultant who is an internal medicine resident she has a very good proposal on comparing the knowledge, attitude, and practices of cancer patients versus non-cancer patients in Cagayan Valley Medical Center. So I found out na maganda yung kanyang proposal. So maybe if we can make this kind of proposal, not only one government hospital, but government has hospitals in region too. The problem is money, non-cash. So, Dr. Francis, where can we get funds for this kind of research? From the DOH or DOST or both or what?
Dr.
I think the consortium can be accessed to tap into the funding of PCHRD.
Yes. Also, I'm going to advise my consultant to submit the proposal to USDPHR. Okay, thank you.
Or to the consortium.
Consortium, Cagayan Valley Health Research. Anyway, I'm the chairman of the Ethics Review Committee of the consortium. Thank you.
Okay. Maraming salamat po. Yes, ma'am.
Good noon. I am Dr. Perez from EPCHRD. Ang tanong ko lang, ma'am, I think it will be Dr. Gomez would be able to answer this. Paano po babaguhin ang mindset ng Pilipino na gusto natin ng premium na products and yet gusto natin laging mura? Bakit ganun?
Pero,
alam naman natin, alam natin yung nutritional benefits. We can explain it thoroughly, they can understand it thoroughly, and then we always go for that mindset na laging mura. Walang mura. Everything comes with a cost. Thank you.
Medyo mahirap yung tanong na yun. Baka ang pinaka-qualified sumagot dyan would be a psychologist. Pero from a marketing point of view, which is medyo may background ako because that's what we do, it really is human nature na you want to always have the best. And even if you cannot afford it, there's always that aspiration at the back of your mind, aspirational. And that is what unscrupulous marketing people try to exploit, the aspirational mindset of the individual or the consumer into tricking them to actually also spending more than what is the real value of the product. So actually, akala lang nila premium quality, yung pala hindi, pero ang binalabas nilang pera yun. So that's what I see as a negative dimension to your question. Pero sa healthcare, being also a former community-based health program din naman ako sa Sorsogon for several years and nag-practice din ng konti pa dito sa Manila before going full-time into business. When it comes to health, kasi parang there should be no distinction between premium and a low-quality product. Dapat lahat yan pareho ang epekto sa tao. Whether mayaman ka o mahirap ka, pareho yung sakit niyo. Dapat walang premium, walang low eh. Personal opinion ko lang, kaya even on sa generic slow, we were one of those that were pushing for it. Dapat talaga yung control ay nandun sa FDA to make sure that the quality of the product is the same, even if it is cheap. And then lastly, yung insight lang sa marketing is
So
it's really the science of marketing to try to make the consumer or the buyer perceive the product as premium. So, baka lang naman na paglalaroan lang ng consumer, akala niya premium si A, yung pala hindi naman. Yung palang tinitake niya is just as good as A. But we don't have parang a standard dito sa Pilipinas. Sa gamot tayo speaking about medicine. Na dapat sana pag pumasaya sa FDA, Whether produkto yan ng multinational, o ng India o China, Bangladesh o Philippines, they should all be at par.
Dr. Mercado, then Dr. Ryan, then Dr. Padilla.
Yeah, I'm going to say something that might be a little bit controversial. Say it anyway. The thing about, I said something about listening and understanding audiences and understanding where the people are. And successful marketers are able to sell products that touch people not because of health, but because clean teeth. No, they're selling popularity, friendship, acceptance, and so on. And therefore, we in health like to think that just because we say something is good for health, that people should necessarily want it. That's not true. You look at the advertisements for rubber shoes, right? I won't say the brand, but they sell these very expensive rubber shoes for women, and they say just do it because it's empowering. Selling a good shoe. So I think in health we have to really think about what is it that people are interested in and market our products around that. And they go around very basic things. People are interested in belonging, in acceptance, in being loved, in being part, not being isolated. These are the things that matter when we're marketing. It's not health. Actually, people don't care about health.
Dr. Ryan, would you like to add up on that?
Yeah, just briefly, no. Kaya tinatawag nila mga tao daw predictably irrational. Well, ang gusto ko lang sabihin siguro is, yung question is a nice research question, especially in the local context. Because not much research has been done in behavioral economics, especially health behavioral economics. So, maganda yung pag-aralan po natin. Tayo na mismong gagawa at tayo na mismong sasagot.
Dr. Padilla.
Actually, there are many players to that issue. And we have to bring them all on board. But number one, if the product is good, sabi lang siyempre, you know, gumawa nun. But somebody has to show the data that is as good as the extension. And unfortunately in the Philippines, Filipino first is not just ingrained in the ordinary Filipino. But how can that happen? That's where policy can come in. So for instance, I know that DOST and DOH are working on the Filipino first concept now. But we have a responsibility as a group of researchers to show that product A is as good as product B. Sa second component, isang packaging lang. Packaging lang, actually all you do is improve the packaging and people get it, they say it's good because extra money was put value into making the packaging good so that it gets more acceptable. So this is where I will say that the researchers, the team of researchers, together maybe with PCHRT, identify those products that we know are very good but have very low acceptability and prove that it's as good. Now on the policy part, and that's why DOH, we have Director Eric Tayo here. Kailangan sabayan nila tayo. Okay, logic kasi ng tao talaga dito sa Pilipinas, pag imported mas maganda, and we all know that's the truth. And I will just use, again, drugs as an example. I got sick in China, and I bought a certain drug, branded, which was a third of the price of what it cost in Manila. So again, that's where policy can come in again, just even drug pricing. So I guess, there's a lot. We have to, all agencies will have to work on this, FDA, DOH, DOST, and maybe this pool of researchers now know that you can pick up actually a topic that you think is important, and then maybe provide the information to government so that it can help them improve the policy direction in their agency.
May
I add lang from a local government perspective? There are two things that are critical why a lot of our patients will prefer a certain type of drug based on our understanding and observation. One is, of course, the popular media. But that can be addressed by the way we purchase drugs. So, kung pinipilit sa isang local government yung policy, as I mentioned, na piliin lang Filipino first drugs, then we could certainly do that. So the problem comes with the second issue. its pharmaceutical management in the local government level. Kung may experience ko kayo sa community health, yung RHU natin, rural health units, most of the time, don't know how to manage medicine. Nilalagay lang yan sa isang lugar, lalo na sa mga rural areas, o minsan nadi-deliver sa amin.
Display area.
How you manage it so that potency will be maintained. The transfer of the drug from the source towards the community, magbababa yung potency niyan. So, based on experience nung pasyente, pag yan yung iniinom ng drug, walang nangyayari. Siyempre, wala na potency yan. Na-expose sa araw, nakatambay sa likod ng ano. I'm not saying it's true for all, but it really happens in rural health communities. That's why there is a perception na pag ganitong klaseng drug, it doesn't work. Even though we've been pushing it and we know it works. Because there is that gap of how drugs are delivered from one end up to the user. Sa LGU po, malaking problema pa yan. And if there are researchers who would like to help us address the particular gap to improve the delivery of the medicines, the supplies, so that it arrives in the local governments, yung kailangan talaga namin, then it helps. Third, pasingit na lang po. Third is, we are given medicines, sometimes hindi namin kailangan, or sobra. So when
yung kailangan, not based on need.
Yes, because, bibigyan ka ng isang katutak na diabetic medicine, ilan lang yung diabetic mo. So that nai-expire yan. Perception again sets in the local level. Iniisip nila yung gamot na binigay na yun, hindi effective. Kasi hindi na pinapagamit. So there's a lot of gap in terms of communicating itong mga gamot. So again, hopefully, this can be improved. I don't know how, or ano yung mga, but hopefully, again, researchers, innovative ideas are most welcome so that we can help change the mindsets at the local level.
Okay, so maraming salamat. Other questions from the audience? Any representative from the Department of Health? I think Director Pangilinan, there's an issue raised here on the distribution of medicines in the different RHUs. Some of the medicines not needed by the RHU.
Thank you for bringing that out, Leah. Yes, we are aware of that. That's why we started to strengthen the registries of our diabetic and hypertensive clubs, which were formed in the communities, in the municipalities and barangays. So yun na lang po ang basis ng pag-allocate namin ng mga non-communicable diseases like diabetes and hypertension drugs to the different municipalities.
Okay, maraming salamat, Dr. Pangilinan.
And to add to that, we have our team of pharmacists going around checking for the monitoring yung supply. Kung may mga nag-overstock, kinukuha nila yon, tinatransfer sa ibang hospitals na nangangailangan.
So it's being done now?
Yes, ma'am.
Okay. Question from the audience. I don't see any more hands. I go back to our panelists. Hinga na po natin sila ng huling mensahe para sa ating tuntungan. We'll start with Dr. Ryan Ginaran.
So, siguro we define inequities as those avoidable differences that results to poor access, that results to poor health outcomes. On the part of vulnerable and marginalized groups, especially indigenous peoples, I would also define it as avoidable similarities because most of the time health programs come to you as one size fits all. And you really have to contextualize it, knowing for a fact that there's a strong social determinant of health affecting the health status of the population. So I would say that inequities come in the form of avoidable differences and avoidable similarities, especially on the DOH or the health service provider side. And all of us as researchers and looking for innovations can turn into the indigenous people's communities for best and good practices that can be scaled up for the benefit of the Filipino people. Thank you.
Maraming salamat. Parting message of Mayor Alfredo Coro II.
Una po sa lahat, I humbly invite everyone to visit Siargao Islands if you have time, and they offer free. There's a lot of flights. Pinakamalapit po sa inyo is Clark direct to Siargao daily. Part of the equity in health. In local government po, isa lang po yung definition yan. Access for all ang health. Regardless kung ano ka, kung mahirap o mayaman, access for all. But designing access in different local government units, different barangays, in different geographical settings, cultural settings is the challenge. And this is where we need the help of research and innovation, because a mayor's term is only 3 years. To ensure sustainability of all of these new programs and innovative ideas, dyan po ang role ng ating mga researchers to help communicate that what was started as good programs should be continued. And there is evidence to show that it should be continued. And that they have a role to play in communicating that it should be continued. Para hindi ho napuputol yung program. Hindi ho tuwing may bagong gobyerno, nagbabago ulit ng program. Kasi maganda naman yung mga program. Ituloy-tuloy lang. Para hindi rin napukonfuse yung public. What public health is all about. Every time you try to communicate something new, nagbabago yung programa mo, malilito rin si public. Ano yung public health niya. So sana, yun nga, again, the role of researchers and innovators is hopefully they could push for the right innovations that are located in the local government so that access towards better public health will be experienced by everyone.
Maraming salamat, Mayor Alfredo Coro II. And now the parting message of Dr. Francis Gomez.
I would like to introduce a different angle again on the equity on health. A lot of the money that we spend for healthcare goes on drugs, medicines, and devices. And these are all sourced from abroad. So a big chunk of the money we spend for healthcare is actually going to other countries. Sana mabawasan natin yun. By you, all of you, doing more vigorous research that responds to the local needs of our people. Hindi naman siguro lahat, pero from let's say, Tagundian, Sambo, padagdagan natin ng 8, karoon tayo ng 10, na lahat galing sa Pilipinas. So yung ini-import natin, yung lumalabas na pera ng Pilipinas, pabawasan. Yun ang napakaganda. At dagdag pa doon, gandaan natin yung research para tayo naman mag-export sa kanila. Ilang po.
Maraming salamat, Dr. Francis Gomez. At ang mensahe po naman ni Dr. Susan Mercado.
Yeah, I think I started out by saying that my hugot was indifference. And I'm going to end with that same message. I think if our research is going to be effective, it should be able to change the indifference of policymakers and of society to the plight of the 20 or 30 million poorest people in this country. I think we still lack strategy in terms of everything that we do. If our help finding something and say, well, you know, I wrote about it and I poorest people in this country.
Maraming salamat, Dr. Susan Mercado. And now,
Patawag naman kay Kuya, Raya. May number ka ni Raya. Kasi yung sa, hindi ko lang download. Sabihin mo magbukas siya ng email.
may we request our panelists to remain on stage as I call on
Thank you kay Jerome.
Dr. Jaime Montoya and Dr. Geraldine Casipit to hand in our certificate of appreciation to our panelists. Now, in place of Dr. Casipit, we have Dr. Imperial.